The skeletal and muscular systems act together to produce body movements. Together, they are sometimes referred to as the musculoskeletal system. The skeletal system consists of three different components: rigid bones, springy, shock-absorbing cartilage that reduces friction between bones, and ligaments, which connect bone to bone. Movements occur at joints, also called articulations, which are points of contact between bones. The muscles of the muscular system attach to bones with tendons. When the muscles contract and shorten, they pull on bones, creating movement at joints.
Arthroscopy is a procedure that uses a specially designed endoscope to diagnose and possibly treat injuries and other disorders in a joint, especially the knee. In the knee, ligaments give the joint stability. Sandwiched between the bottom of the femur and the top of the tibia are the medial and lateral menisci. Normally, cartilage cushions the joint, helps stabilize it, and allows the bones to glide smoothly with movement. If the menisci are torn, the unstable knee may click, pop, or lock with movement, and the patient may have localized tenderness, pain, and effusion. If the problem is severe, the patient may undergo arthroscopy to treat the torn meniscus. To begin, the surgeon makes 2 or 3 keyhole incisions and inserts trocars. Next, the surgeon instills a sterile solution to expand the joint for better visibility. The surgeon then inserts the arthroscope and other instruments through the remaining incisions. By using the arthroscope's light and camera, the surgeon can view images on a video monitor to examine the inside of the knee and evaluate the problem, which in this case is a torn meniscus. To continue, the surgeon cuts off the damaged portion of the meniscus. Then, a motorized shaver is used to trim any frayed edges. When the repair is completed, the surgeon again irrigates the joint to check for other damage and then drains the sterile fluid. After removing all the instruments, the surgeon closes each incision. A dressing and bandage are then applied.
The spine consists of bony vertebrae, intervertebral discs, which support and cushion the vertebrae, and the fragile spinal cord, which is protected by the vertebrae. The 4 areas of the spine are cervical, thoracic, lumbar, and sacral. In any of these areas, the intervertebral discs can thin and break down. These changes can result in spondylosis, or joint space narrowing and deterioration. Degeneration of a disc can also cause its contents, the nucleus pulposus, to herniate. This can put pressure on the nerve root and cause such symptoms as pain, numbness, tingling, and weakness in the area served by that nerve. If symptoms don't improve with medications or physical therapy, the patient may have a discectomy or removal of the nucleus pulposus using either a standard surgical approach or a fiber optic approach. With the standard approach, the surgeon makes a small incision, in this case over the L4-L5 disc space. Using retractors, the surgeon then widens the opening. Next, the surgeon resects part of the lamina and facet joint to gain access to the disc space. After elevating the nerve root to expose the herniation, the surgeon removes the protruding part of the nucleus pulposus. When the discectomy is complete, the surgeon closes the incision over the decompressed disc.
Healthy adult bones are strong enough to withstand normal forces without breaking. In contrast, a child's growing bones have more collagen, making them more flexible. Typically, a child's bones crack on only one side, and greenstick fractures are most common. Both greenstick bone fractures and hairline fractures are called incomplete fractures. A greenstick fracture is an incomplete one in which the bone bends and fractures only in the outer arc of the bend. A hairline or stressed fracture is an incomplete fracture that is the result of repeated trauma over time. It causes small cracks that appear like thin lines on an X-ray image. In contrast, a complete fracture is a break that goes through the full thickness of the bone. Adult bones that are affected with such diseases as osteoporosis or cancer cannot withstand normal forces and will break more easily. These breaks are called pathologic fractures and are more likely to be complete. The direction and type of force will determine the fracture's pattern. A transverse fracture occurs straight across the width of a bone. An oblique fracture occurs at an oblique angle. A spiral fracture winds around the circumference of the bone. A comminuted fracture breaks the bone into two or more pieces. A compression fracture usually occurs in the vertebra, causing the bone to collapse. A complicated fracture involves injury to nerves, blood vessels, or other soft tissues. An impact fracture occurs when one section of a fragmented bone wedges into the next one. In a closed fracture, the bone does not break the skin. In an open or compound fracture, the skin is broken, and a piece of broken bone pierces the skin. These fractures are susceptible to bone infection. Before a fracture can properly heal, a procedure called reduction places the ends of the bones back into normal alignment if the fracture has caused them to become misaligned.